Welcome to the Drug-Free America Foundation's Pathways to Prevention podcast, where our vision is a world free from the burden of drug abuse. I'm your host, Dave Clausen, and today we have an inspiring episode for you. But first, I want to thank you for tuning in and thank you for your ongoing support in helping make this world a better place. Now, before we dive into today's episode, I want to highlight an incredible resource we have for you. If you missed our recent webinar, It's Just Pot, What's the Big Deal? Case stories from the front lines. You can still watch the recording and access all of the resources via our website, dfaf.org. The link is also in the show notes below. Now, this webinar features Dr. Branislava, an expert in emergency and addiction medicine, who shares real-life case reports from the emergency department. Dr. Lev brings a wealth of experience from her frontline practice and her notable career, including serving as a first chief medical officer of the White House Office of National Drug Control Policy. She chairs the San Diego Community Response to Drug Overdose Task Force and established the San Diego Prescription Drug Abuse Medical Task Force. Dr. Lev's insights are invaluable, so be sure to check out the webinar recording for a deep dive into her expertise. Now, today's episode. In this episode, we dive into the power of international cooperation in drug abuse prevention, featuring insights from Branislava, a passionate advocate from Serbia. Though we miss connecting in person at C&D this year amidst a sea of amazing individuals, I'm thrilled to have had the opportunity to speak and connect with her now, and I'm excited to share her inspiring story, her journey from law school to making a significant impact on drug policy and international cooperation. She brings a unique perspective on how listening, collaboration, and a multidisciplinary approach can drive meaningful change in the fight against drug abuse. Now, without further ado, let's dive in to this engaging conversation with Branislava and explore the lessons we can learn from Serbia's approach to drug abuse prevention. The vision, a world where all people live free of the burden of drug abuse. This is the Drug-Free America Foundation's Pathway to Prevention podcast, where we are committed to developing strategies that prevent drug use and promote sustained recovery. Thank you for not only tuning in, but your continued support and efforts to help make this world a better place. We hope you enjoy this episode. All right, folks, it's time to start this wonderful conversation with Branislava. And unfortunately, we didn't get to connect at C&D this year. It was filled with so many amazing human beings. It was hard to connect, but I'm so glad that we got to continue and pick up and connect now. So thank you for taking time to chat with us today.
Thank you so much for having me. It's an honor to be here today with you. I would like to say a personal thank on behalf of the Office for Combating Drugs for having us here and to be able to participate in this and to be able to talk about such an important things like combating drugs. So nice to finally meet you. I want to say in person, but through this podcast, and hopefully we'll get a chance next year on C&D to meet you in person.
It would be a delight. And before we really get into the work your office does, would you mind sharing a little bit with us about who you are and how you came to work there in the office?
Yes, of course. I've started working here 3 years ago. I'm a lawyer. I have finished bar exam a couple of years ago, and I started working here because I wanted to make a difference. I wanted to be able to help people who are in recovery process through participating in creation of public policy documents. So I thought that this was the right place for me to be able to do that and to participate in international cooperation, which is one of the strongest suits of the office. So that's why I joined this team.
I like it. And top of mind, what is one of the things you love about your job?
Being able to work in international cooperation, I've never done that before in my previous jobs. So I realized that that is something I love doing, and to be able to meet so many different people in this area and to share all those important things about combating drugs and to share experiences. So if I have to pick one thing, that would definitely be international cooperation.
I gotta tell you, that was one of the things that just amazed me at C&D was the amount of people from different countries that all came together to unite around prevention, treatment, and recovery. Like the passion, the wisdom, the experience just filled my heart. It was a wonderful time. And that was, did you say your third time at C&D?
Yes, yes. It was the second time I was in the office when we actually organized a side event. A year ago, two times we organized a side event, and one time I was just there listening to other C&D events. So it was a great opportunity to be able to meet so many different people. And every time I go there, I'm just honored and privileged to be in the United Nations in Vienna. It's such a privilege.
Same. Yes, indeed. And I know you mentioned, the office organized a couple, like two side events over the years. And tell me a little bit about what the Office for Combating Drugs does.
I would like to narrow down all the activities that we are doing and put them in four different categories. First one would definitely be coordination, cooperation, collaboration. That means that the office coordinates work of other state administration bodies and civil society organizations in the field of combating drugs. We aim to support and help especially local self-government units in their aim to create local public policy documents and to, if they're struggling with some, let's say, difficulties, to help them overcome those. We have strong connection with civil society organizations in the Republic of Serbia in this area. We have signed a memorandum of cooperation with 26 civil society organizations, and we want to be able to contact with even more organizations in this field. The government of the Republic of Serbia fully supports us in our aim to create like a positive environment for those organizations and to be able to present their work due to a successful cooperation with the civil society organizations. One of the civil society organizations called Izlazak, through a project that has been implemented in the Republic of Serbia called I Choose Recovery. We have formed multidisciplinary teams. We can talk about that a little more after this. One of the things that we do is, like I told you, we have international cooperation with MCDDA, UNODC, and other organizations, both regional or international. And we participate in creation of public policy documents and in the implementation of them in the Republic of Serbia. So those are the main characteristics of our activities. But of course, we do much more than those. But let's say those are the biggest ones.
You all do a lot. Thank you for such a clear and succinct summary. And yes, lots we can really dive in and talk about. I want to first touch on collaboration. Y'all collaborate at multiple levels, at the local level, but also at the international level. So what might be some advice that you could offer our listeners when it comes to collaboration?
We're strongly advocate for multidisciplinary approach. We try to collaborate and cooperate with all other civil society organizations and state administration bodies because we think that only if we cooperate together, we can do something meaningful in this area. Doesn't matter if it's prevention or rehabilitation or harm reduction, but as long as we stick together, I think that we can make a difference. So we strongly advocate for that. We connected with local self-government units through this project, I Choose Recovery. And we saw that they are struggling with financial support. They do not have civil society organizations because they are struggling with financial support. And we wanted to be able to hear those problems, to help them connect with each other, because those multidisciplinary teams I was telling you about are constructed of teachers, social workers, prosecutors, office, judges. And we wanted to, help them be in a constant contact with each other, and to be able to be in a contact with other multidisciplinary teams, with other municipalities in the Republic of Serbia. So we wanted to merge everybody so we can work this together.
And the very first thing that I heard was you listen first before bringing folks together. And I like that rather than, jumping in with the solution. It's let me listen first to then see how I can help. When it comes to collaboration, now that you've got a few years of experience in your current role, what is a piece of advice that you would share with somebody starting in your position that you now have learned?
Well, first thing that comes to mind is to go to those conferences, roundtables, participate in webinars, online seminars, to be able to hear those people who actually do that work, and to learn a lot about combating drugs per se, and feel strong enough to be the part of those things later on. And so you can actually talk about those things because you didn't have previous experience, let's say, in the past. So to me, it would be to listen, like you said, listen carefully, to ask questions, to just be interested in this area. You need to love what you do in order for you to do it as best as you can.
All right, listeners, did you hear that? And take notes to write all of that wisdom down. Hopefully so. If not, feel free to rewind to grab those thoughts. Could we chat a little bit more about the office and whether it be policy work or strategy work? What do you have going on in that area?
Unfortunately, we do not have in the Republic of Serbia public policy documents such as strategy for prevention of drug abuse. The last one we had in 2021, it expired and was successfully evaluated. So we are currently in a position of creating some sort of document that will help us along the way to create a strategy. So we want and we advocate for a strategy that will lean on the European strategy on drugs. We think it's important because it talks about recovery cities, about harm reduction, and things that our previous strategy wasn't so keen on, let's say. So we want to make a difference in that area. So we're hoping that in the next year, or maybe this one, I'm not sure, but we will have a public policy document. So currently, we do not have that document.
What were some things in the past strategy document you remember that you had?
Well, it was divided into fields like prevention, drug reduction, drug demand, and etc. That it had 6 parts of the strategy. I remember that we need to, in that evaluation process, we had 2 international experts that talked with everybody who participated in the creation of that document alongside civil society organizations because they wanted to hear them as well. And I remember that we needed to strengthen even more our relationship with civil society organizations. I mean, I think that they're not as visible as they should be. And I think that they should be included in the creation of this strategy or this public document from the start. And I remember that there is a lack of communication with them, even though they've been a part of it. So I would emphasize that.
Okay. And now you're in the process of creating a new one. What does that process look like? How do you go about creating a strategy document?
In Republic of Serbia, it was an election year, so the ministries are not still formed, so that delays a bit a process of creation of that document. So we have a working group for creating an operational plan that will be, it's not a public policy document, but it's something that will implement until we create a strategy. So until we finish that part, we cannot proceed with the implementation or creation of strategy, but we are in a process of getting things done in that area.
Okay. And I'm curious, just as a whole for the Republic of Serbia, what are some challenges that you see when it comes to combating drugs?
Ooh, tough question. Well, I'm going to say financial problems, maybe, for civil society organizations to be more visible. I'm going to say that we need more projects in this field that should be implemented in the Republic of Serbia, that much more money should be devoted to rehabilitation. We mentioned therapeutic communities. In the Republic of Serbia, there are 4 therapeutic communities, but our positive legal framework does not define them as a part of rehabilitation process. But in practice, they do fully support people who are in recovery. So we need to have a stronger system to be able to recognize those therapeutic communities in legal framework in order for them to actually provide even more work, to get financial support and stuff. So I'm going to say that that's a lack of our system.
Okay. And where do you see or feel some progress?
Well, I think in prevention field, I would like to say that we've been a part of the implementation of UNODC project Listen First. We are very proud of that project because Republic of Serbia is one of the few countries that project was implemented. That project actually helped me to understand how it's important to listen carefully to your children, to be able to help them create a healthy lifestyle, to actually listen to them actively. And it targets parents, social workers, teachers, and all people that actually work with children. So that project was being implemented in the Republic of Serbia for 2 years now. And I was proud of that because I think that we made some difference in the prevention field. I think that we wanted to reach out as much audience as possible. So we implemented that project both in online campaign. We took an online campaign. We had a promotional material about that. We had conferences, roundtables. So I guess if I have to pick one part of the strategy, or at least in this field, I'm going to go with prevention. That I think that we made some serious progress, not just Republic of Serbia. Yes, of course, but even in the local self-government units as well, because they were the part of that project. We were able to connect them to be part of this.
That makes me happy being a prevention, all about prevention. And so I love that you're making progress and reaching such a wide audience when it comes to prevention. You had mentioned I Choose Recovery. Can you tell me about that, please?
Yes, of course. That was a regional project implemented by 3 civil society organizations. One of them is Proslavio Oporavak, is Montenegro. One of them is Udruženje Izlazak, Association Izlazak, sorry. I said that in Serbia. One of them is Mulka's organization. Sorry, Branislava Oporavak is from Bosnia and Herzegovina. So that was a regional project that was implemented in those countries like Montenegro, Bosnia and Herzegovina, and Republic of Serbia. It was about creation of inclusive cities. It was the idea of Professor David Best from the United Kingdom. He created an inclusive city, and he wanted to show that recovery is as important as prevention. So together, alongside the Association Izlazak, we actually formed those multidisciplinary teams in local self-government units. So we visited over 70 cities in the Republic of Serbia. We talked about all different kinds of people who work in different areas and different fields, like judges, teachers, prosecutor's office, etc. So we were able to see and to hear about their problems, the things that they were facing, the things they were challenging. And after that period of time, we've done that in 2 years. After that, we signed a memorandum of cooperation. I mean, we formed those multidisciplinary teams in those local self-government units. And it's something that we're really proud of because we were the part of that, because those civil society organizations actually did something great. Serbia is, I think, the only country in the region, Western Balkan regions, that actually does have those multidisciplinary teams. That was the thing that we were talking about in the previous CND last year. We talked about inclusive cities. And last year, we talked about a professor from England as well, Mr. David Patton. He was the one who told us about one more inclusive city in the UK, in Middlesbrough. So we wanted to connect them in the future as well, so we can see challenges that they're facing and to exchange positive aspects of those teams.
I'm noticing a theme. Actually, I'm noticing two themes. One being you are very intentional about listening to others to better understand. But then also, it feels as though one of your principles is that together is better, is bringing people together around this work, both prevention and recovery.
Yes, it's something that we, like I said at the beginning, that we strongly advocate for: multidisciplinary approach, collaboration, cooperation. We really want to be a part of something bigger, and we think that the only ways actually to connect with other people, other state administration bodies, other civil society organizations, not just in the Republic of Serbia, but in the region as well, like we've done in the past. So I think that it's something that we're proud of and something that we will continue on doing in the future.
I love that. I love that. Prevention is better together. Recovery is better together. Just together is better. Absolutely. We talked a little bit about sort of what's in the future in regards to creating a new strategy. What else do you see on the horizon or in the future? What are you looking towards or working towards?
Well, we would like to create more multidisciplinary teams in the Republic of Serbia because they've been very successful. And after the strategy for prevention of drug abuse is being created, we would like to help local self-government units in order for them to create their local strategies, local action plans in this field. We would like to work more with therapeutic communities to help them be a part of our legal framework. We're hoping that it will happen at some point. And we would like to have more organizations like this because they are doing a wonderful job in the Republic of Serbia. I would not emphasize that enough, I think. And that was our team in this CND. We talked about those therapeutic communities in the Republic of Serbia. And I'm hoping that we will be able to help them in the future to work with even more people, to help even more people in the Republic of Serbia, and that will be able to provide not just our support in the rehabilitation process, but also in harm reduction, in prevention, and all fields in combating drugs.
So I'm putting myself in the perspective of a local community that here's this podcast episode and here's all of the great work that you are doing, and they might feel a little overwhelmed or nervous about how do I engage with the government to learn, to connect, to share. What advice would you offer them?
To be persistent, to not give up, to reach out, to contact government's body. And I guess that works the same in different countries in the Balkan regions. In our case, is just to contact us. We will do as much as we can to help them, and we will go on a meeting with them. We'll help them create those documents or to connect them with other civil society organizations or other state administration bodies as much as we can within our restrictions of our legal system, we would do.
Because you care.
Yes, exactly.
Very, very clearly, you care. Yes. Before we end our conversation just for today, could we spend a little time talking more about the therapeutic communities? Can you give us an overview or describe sort of what those are, what that means?
Of course, in the Republic of Serbia are 4, at least that we know of and that we have signed a memorandum of cooperation with. But there are 4 therapeutic communities that work in different fields of drug addiction problems. They are in different parts of Serbia, not all of them are in our capital city. Two of them are in other cities in Serbia. They are trying to do a great job with assets that they actually have, because they do not have as much financial support as they should, but they finance their work through funds, through charities, mainly charities, through the help of church, because the church is actually really helpful in this field. They are trying to help people go through recovery process. I mean, of course, we have institutions, state administration bodies that are responsible for that, but there are people who, after undergoing that process, will still like to continue the rehabilitation process, and they can do that in those therapeutic communities. So that process lasts from, 15 months till 30 months in that therapeutic communities. They have worked there. They have, shared responsibilities. They pretty much do everything they can to help them reintegrate in social life after they finish that recovery process. So one of the cities that actually has a multidisciplinary teams was actually able to help them find a job after recovery process, because in the Republic of Serbia, there is still a bit of stigmatization when it comes to those people, even though they finished the recovery process. But we're struggling and we're trying to help them as much as we can. We are trying to raise awareness about helping them get a new life, if I could say that, helping them fully reintegrate after they finish that process. So I think those organizations do an excellent job. We are in a contact with them as much as we can. We are visiting them as much as we can. And every time we go there, seeing those people, seeing those kids, because there are so many kids that unfortunately are undergone that process, and seeing them feeling better and wanting to proceed and wanting to get a new life is so great that they have that opportunity. It's so great that they found something that it will help them move on.
And when it comes to recovery, what is something that you have learned about recovery that you didn't know when you first started in your position?
I think that I learned that you can do everything you want as long as you put your mind to it, as long as you work hard for that, as long as you want to make a difference. I think that seeing them and hearing their stories, their live experiences, makes me feel sorry for them for, being a part of something that was not good for them and having struggled with that for so long. But seeing them now, it gives me a feeling that there is a hope that you can get better if you want that you can have a normal life that you've had before all that. And it makes me feel that you can actually do something for yourself, not just even in this field, in every other field, of course, but this one in particular.
What is something that you've learned about prevention since you have started in your role?
Well, I realized that I've been talking a bit more about recovery, but I think honestly that prevention is as much as important as recovery. They're the opposite sides. Nonetheless, they're the same in that field. I mean, I think that we should have more prevention programs, more prevention projects. We need to work with children more. We need to have, peer education. We need to have peer education is something that I would like actually to emphasize, because I think that children have more that they will lean on better, let's say, in somebody who is their own age. So I think that we need to educate more peers. One other civil society organization that we actually work with is called Regeneracija. They're working in the field of harm reduction, and they had all different kinds of projects that they've been implemented in these past years. And main thing that I would like to say about them is actually that they try to educate peers about drugs. They are trying to educate people who work in nightclubs in the Republic of Serbia to be able to recognize everything that it's not normal, and to be able to help those people in need. So actually, harm reduction does matter. Also, prevention does matter, and we need to educate everybody. And we must not stop doing that, because the more prevention you have, the less recovery you will get. I mean, because people will believe in the power of prevention.
I believe in the power of prevention. It is oh so important as well. But yes, just like you said, across the board, from prevention to recovery, emphasizing all of it. I love how you said we need to educate everybody, because everybody does play a part. Everybody does have a role. I want to just open up things to, is there anything that we haven't talked about that you want to share with our audience?
Well, I think I've said we've covered all the bases, let's say. But I want to, just finish by saying that we strongly believe that there is a place for everybody, that everybody should be included, that prevention does matter, that harm reduction does matter, recovery does matter, and that, like I said at the beginning, multidisciplinary approach is something that we all should be doing. And in order to get things done, to be able to help everybody. So education, seminars, webinars, whatever, but just to educate more people.
And with that last bit of wisdom, I will say thank you very much for taking time to chat with me and share all of the work that you have going on, and all of the wisdom that you've started to gather over the years of listening, learning, and connecting with others. So thank you very much for that. And thank you for doing the work that you are doing. It's been a delight.
Thank you so much for having us. Thank you so much that you recognized as somebody who you like to have a conversation with, and to share, to be able to talk about our work. And we just really, really want to make a difference in this area. And thank you so much for recognizing that and for having us in your podcast.
You are making a difference. You are.
Thank you so much.
That concludes this episode. Thanks for tuning in. Be sure to hit the subscribe button and share this episode with a friend before you leave. And we look forward to seeing you on social media, because prevention is better together. Together, we are stronger.